Good day, everyone. My name is Shelley Fyatt. I'm the chairwoman of the Confederated Salish and Kootenai Tribes, and I'm here today with Bill Barron, Lake County Commissioner, and we just wanted to check in with the community and just give a little encouragement about kind of what we're going through with the pandemic. One thing that I've seen is something called pandemic fatigue or pandemic exhaustion. And I guess in doing a little research, kind of what that means is people are just so tired and so frustrated and are becoming complacent and taking unnecessary risks due to the things that are put on us. But I'm here to tell you today that we are in this for the long haul. It's not going to be over at the end of 2020. We're still looking for an approved vaccine at this point. And I think that these sacrifices that we're making are very much necessary and unlike anything that we've ever experienced previously. And one of those is wearing masks. I get really frustrated wearing a mask myself because sometimes it's hard to breathe when you have to talk a lot. My glasses fog up. It's just really frustrating, but it is a proven fact that is a way to slow the spread. So, as well as physically distancing. They say that if you're exposed to someone for 15 minutes, and it doesn't have to be 15 minutes at one time, it's a total of 15 minutes that you could, ingest those airborne materials. So, another really important thing is sanitizing. We tend to get lax about it at home. We're pretty vigilant at work, but sometimes when we get home, we don't wear masks, and maybe we have family members that come to visit, and we just get a little too comfortable in that way. And some of the things I've been reading recently have said that that's where a lot of the community spread is happening. So I just wanted to encourage folks to think about that. And the last thing is staying home. Early on when this happened, you hardly saw a car out on Highway 93. And on my way up here this morning, it was bumper to bumper both ways. And so, that's one thing we can do is stay home and try not to go anywhere unless it's really, really necessary. So with that, I'll turn it over to Bill.
Like Shelley, I think we're just getting too complacent. And I'll be the first one to tell you, I hate these masks with a passion. I do not like them, and if I had my way, I wouldn't wear them. But it is one thing we can do that's going to help in the spread of this. It might not be the perfect answer, but it's going to help. And we have to do everything we can to try to curb this. A lot of people like washing your hands and things like that. That's extremely important. Even if you don't have the antibacterial soaps and stuff, just washing your hands. Hot water and soap are very important. Stay clean. At our health board meeting, they gave us stats as of October 20th. And October 20th, we had 508 confirmed cases in the county. That's how many we've had total so far. As of today, 3 days later, we have 551 confirmed cases that we've had, right? We had 126 active cases on the 20th. Today we have 134. The people are recovering, and that's great. We had 380 on the 20th and 417 today. The hospitalization rate has stayed steady at 29, and the deaths, we are at 2 at this point in time. But you just look at that, a 3-day period, the jump we've had, and you look at the number 2 and 3 areas in the state for growth, for exposure and new cases is Flathead, Kalispell, and Missoula. And we're right in the middle of that. And we're going back and forth all the time. People are going to those cities back and forth. I had to go on some business to Kalispell, and I was really surprised at the number of people that didn't wear masks in places I thought they would. Even if you think, I mean, I'm a pretty conservative individual, and I don't like the government telling me what to do. And the thought that they're trying to make you wear masks, I had the opportunity finally to see my granddaughter, or grandson and daughter, and the whole time I was with them, I was thinking about my mask and that I was glad I had it on, because how bad I would feel if I carried or gave something to my family that I don't get to see very often. So it's extremely important to wear your masks, I believe. And there's just a few more things. I'll let Rob zoom in on this, but on this bottom chart here, this shows the cases and how they ran up until about the 4th of July. And from the 4th of July, they've just gone up and up and up. They went up and kind of leveled off a little, and now they're going up very fast. And we don't know where it's going to end. I mean, there's community spread now. It's hard to contact trace people to see who's been affected and who hasn't. This shows number of new cases by the day, and there are days where we've had 40 new cases show up. That's huge. That's for an area like ours, that's just not acceptable. I think the age bracket chart here is pretty interesting too, because you see where it starts going up. This is ages 10 to 19. Ages 20 to 29 is seeing the most number of cases. Everybody thought, well, it's all elderly people in nursing homes and things like that, but it's not. It's in a lot of different cases. Then we have the 30 to 39, and then the 40 to 49, 50 to 59, and 60 to 69. It's from 10 to 79 where we're seeing the most cases, but by far the most in these earlier, younger ages here. So this isn't an old person problem. It's everybody's problem. It's something we really need to look at. And people think it's confined to a certain area, but I guess I should just keep this up so you don't have to zoom in and out. But this is Polson. Polson's had 200 cases. Ronan has had a little over 100, about 125. And these are all as of the 20th of October, so it's changed since then. Pablo, Big Fork, Charlo, there isn't an area in the county that hasn't been touched by cases. And if you, I didn't figure percentages to see what the percentages are like. I'm just showing you the number of cases in the different areas. So it's not confined to one specific area, something like that. It's and a question it's a question we get all the time. People want to know, well, what's the tribal, non-tribal demographic? Well, non-tribal is about 59.4%. Tribal is about 40.6%. So it's commensurate with the populations, more or less. It doesn't matter. It doesn't matter. It's not something that's going to affect one group worse than another. It's affecting everybody. And it's just something that the county, we require masks in the county buildings. When you come in, if you're in any of the public areas, you have to wear masks. Now, we've stayed open, and I mean, our treasurer's office is just getting slammed. We have people waiting 20 deep outside the building on a daily basis, trying to get licenses and things like that. But when you get inside, you have to have your mask. When you get into a private office, there's a little more flexibility there, but if you're in any of the public areas at all, you do have to wear your mask. It's something we endorse and we support. It's not going to go away. It's here.
And I think going back to that, it is a personal responsibility. We as the tribe and Lake County, you know, we are not in a position to be able to enforce and, you know, respond to calls about masks and everything. But, so I think it really does come down to a personal responsibility. And like Bill said, you know, he's wearing a mask so that he can protect his daughter and his grandson. And that's kind of where we have been focusing our efforts on the youth and the elders. You know, we definitely want to protect our elders as keepers of the culture and the language. And, you know, we want to protect our young people because those are our future leaders. So, you know, please do what you can in your home. That's all we have control over is, you know, our own family and our own homes. So, and just a reminder that the way we move forward in these fall and winter months is not going to be the same as what we did in the spring. So in the spring, you know, we shut down, you know, did everything we could do, but, you know, given the weather and we could be outside and we can, you know, recreate. We're very lucky here that we, you know, have the space and the freedom to be able to do that. Now we have the change in weather that just happened overnight. We have flu season, which is upon us. So things are going to affect us very differently. And I have a few friends that actually contracted the virus, and they were telling me that, and they're one of the lucky few that have recovered. And while we don't know the long-term effects, you know, it's just too new to have even been studying that or tracing it. You know, they've all said that it's not like the flu where, you know, you have it for a week and then a couple of weeks later you're 100% again. It's not like that. People are talking about how tired they are and some of the, you know, breathing difficulties and just the plain physical exhaustion that they can't do their work how they normally did it, you know, physical labor. So, you know, we don't know the long-term effects yet, but we do know that it is very real. I've heard some pretty devastating stories about people that weren't so lucky and those families that went to not visit them in the hospital, but be outside the hospital window because you can't be in the hospital room with them. And that's just so sad. I had hoped that we wouldn't have to report any tribal member deaths, but we had our first death last week. So that was something I was very sad to hear about. But I just wanted to encourage people that there is light at the end of the tunnel, that there are so many things that we can do. It's not how we used to do it, but there are things that we can do, and we're so lucky here that we have the great outdoors that we do. You know, we can still do those winter activities of hunting and fishing, ice fishing. We can still do our storytelling and our beading and, you know, those winter activities that we do. And maybe it's not the same way we do it. Maybe our storytelling that we normally did around the living room floor or the campfire, maybe now it's going to be via Zoom. Or whatever, however it is. We're lucky that we have all these amenities. It's not like the flu of 1918 when, you know, things were the way they were. We have a lot of amenities here that we need to be thankful for, and we will get through this.
You know, it's very unfortunate. It's become a political issue, and we have to take the politics out of it. The fact is, this virus is a very real thing, and the fact is, it's going to be here for a long, long time. We'll develop ways to deal with it, but I don't think it will ever go away. We have to use our common sense. We have to take precautions, and you know what? We will be inconvenienced by it, but it's little inconvenience is much better than the alternative. I've got friends, a family, the husband and wife are in their 30s, and the husband contracted it, spread it to the wife and some kids in the family, and the wife and children had very minor effects from it, and the husband is extremely painful, having a bad time, very sick, severe headaches. It affects different people different ways, but it's here and it's affecting all of us.
So if we could just remember that also that we could be asymptomatic, but we might be carrying those, we might be carrying the virus and spread it to our loved ones unintentionally. So please wear your masks, physically distance, you know, keep your place sanitized, and stay home unless it's absolutely necessary to go somewhere. So thank you everyone for listening today.
Thank you very much.